Did you know that approximately 5% of children and 2.5% of adults worldwide are affected by ADHD? In the United States, nearly 6 million children have been diagnosed with this condition, and many of these children carry the challenges of ADHD into adulthood. Research indicates that 70% of children with ADHD continue to experience symptoms into their adult years, impacting their ability to maintain relationships, achieve academic success, and excel in the workplace. But what exactly is ADHD, and why should you care? Attention Deficit-Hyperactivity Disorder, or ADHD, is a neurodevelopmental disorder that manifests in early childhood and often persists into adulthood. It's characterized by persistent patterns of inattention, hyperactivity, and impulsivity that interfere with functioning or development. ADHD is not merely an issue of being easily distracted or energetic. It is a complex condition that alters how the brain processes information and regulates behavior. Research has shown that ADHD affects brain structure and function significantly. Neuroimaging studies indicate key differences in areas of the brain responsible for attention, impulse control, and executive functions, specifically the prefrontal cortex, basal ganglia, and cerebellum. Individuals with ADHD often exhibit altered levels of dopamine and norepinephrine, neurotransmitters crucial for attention and behavior regulation. This neurochemical imbalance can lead to difficulties in filtering irrelevant stimuli, maintaining focus on tasks, and managing impulses, which can profoundly affect daily life. For instance, while studying for an exam, a person with ADHD might struggle to concentrate on their notes, as their mind jumps from thinking about the material to remembering a conversation they had earlier to wondering what's for dinner, all within moments. Imagine waking up for a busy day at work or school. You have multiple tasks to complete, but your mind races with thoughts, and your body feels restless. You might start with good intentions, checking your emails, preparing for meetings, or studying for an exam, but distractions are everywhere. Maybe it's your phone buzzing with notifications, a co-worker's conversation, or even your own thoughts pulling you in different directions. For many with ADHD, this constant battle against distractions leads to frustration and a feeling of being overwhelmed. Daily routines can become chaotic. Simple tasks, like organizing a workspace or following a recipe, can feel Herculean. A student with ADHD may sit down to study but find themselves suddenly engrossed in a YouTube video on a completely unrelated topic. They may intend to study for just 1 hour, but 3 hours later, they realize they haven't opened their textbooks. So how do these challenges manifest in the lives of those with ADHD? Individuals may struggle with time management, often underestimating how long tasks will take or feeling paralyzed by the sheer volume of tasks ahead of them. They may forget important appointments or miss deadlines, leading to chronic feelings of stress and inadequacy. Social relationships can also be affected. Impulsivity might lead them to interrupt conversations or make hasty decisions that strain connections with friends, family, and colleagues. For example, someone with ADHD might forget a close friend's birthday despite having good intentions to remember, leading to feelings of guilt and embarrassment when their friend mentions it later. Now let's explore the signs and symptoms of ADHD in more detail. Symptoms can vary widely among individuals, but they generally fall into 2 categories: inattention and hyperactivity, impulsivity. Inattention symptoms: difficulty sustaining attention in tasks or play, often becoming easily distracted by extraneous stimuli. Frequent careless mistakes in schoolwork or other activities, showing a lack of attention to detail, difficulty organizing tasks and activities, leading to disorganized workspaces and missed deadlines, often losing items necessary for tasks and activities such as keys, homework or mobile devices. Forgetfulness in daily activities such as forgetting to pay bills or return phone calls. Hyperactivity and impulsivity symptoms: fidgeting or tapping hands or feet, often finding it challenging to stay still in situations where it is expected. Difficulty remaining seated in situations such as classrooms or meetings, leading to frequent getting up or moving around. Talking excessively, interrupting others, or blurting out answers before questions have been completed. Impulsive decision-making, such as making large purchases without considering the consequences. Blurting out answers before questions have been completed, which can disrupt learning environments and social interactions. interrupting or intruding on others, leading to strained relationships and potential conflicts in both professional and personal spheres. For example, a child in a classroom might raise their hand to answer a question, but unable to wait, shouts out the answer, disrupting the teacher and their classmates. This impulsivity can lead to reprimands and embarrassment, reinforcing negative self-perceptions. It's crucial to note that not everyone with ADHD will exhibit all these symptoms, and they can manifest differently depending on the individual. Some may present predominantly inattentive symptoms, while others may show more hyperactive and impulsive behaviors. Now that we understand what ADHD is and how it affects daily life, let's talk about solutions. Living with ADHD doesn't have to be a constant struggle. There are several effective strategies and treatments available that can help individuals manage their symptoms and lead fulfilling lives. Working with a therapist can be incredibly beneficial. Behavioral therapy focuses on developing coping strategies and organizational skills. Techniques such as cognitive behavioral therapy, or CBT, can help individuals understand their behavior patterns and develop strategies to overcome the challenges posed by ADHD. Therapists can work with clients to create structured environments and develop routines that minimize distractions. For example, a therapist might help a student create a study schedule that breaks assignments into smaller, manageable steps, incorporating regular breaks to prevent burnout. For many, medication can provide significant relief from symptoms. Stimulant medications such as methylphenidate, commonly known as Ritalin, and amphetamine, known as Adderall, are commonly prescribed. These medications work by increasing levels of dopamine and norepinephrine in the brain, helping to improve focus and reduce impulsivity. Non-stimulant options such as atomoxetine, also known as Strattera, are also available for those who may not respond well to stimulants or prefer to avoid them. For example, a young adult might find that after starting medication, they can concentrate better at work, complete tasks without becoming overwhelmed, and feel more in control of their time. Incorporating regular physical activity, maintaining a structured routine, and practicing mindfulness can greatly enhance focus and emotional regulation. Regular exercise has been shown to boost neurotransmitter levels, which can help improve attention and reduce impulsivity. For example, a person with ADHD may benefit from engaging in physical activities they enjoy, such as dancing, swimming, or team sports, as these can provide an outlet for excess energy, while also improving mood. Using planners, timers, and reminders can help manage daily tasks more effectively. Digital tools and apps designed for task management can aid in keeping track of responsibilities, deadlines, and appointments. Visual aids, such as color-coded calendars, can also be helpful. For example, a student might use a digital calendar that sends reminders for upcoming assignments and tests, helping to reduce anxiety around forgetting important dates. Connecting with others who understand the challenges of ADHD can provide emotional support and practical advice. These groups can foster a sense of community and shared experience. Sharing strategies that have worked can help individuals feel less isolated in their struggles. For instance, an adult with ADHD might join a local support group where members share tips on managing work stress, balancing family life, and coping with feelings of overwhelm. Practicing mindfulness meditation, yoga, or deep breathing exercises can help improve focus and reduce anxiety. Mindfulness teaches individuals to stay present and aware, which can be particularly beneficial in managing impulsivity and emotional regulation. For example, a college student may take 5 minutes each morning to practice mindfulness meditation, helping them start the day with a clearer mind, ready to tackle their coursework without feeling overwhelmed. ADHD is a complex disorder that impacts millions of lives, but with the right strategies and support, those with ADHD can thrive. Understanding the condition is the first step toward managing it effectively. If you or someone you know is struggling with ADHD, reach out for help. Remember, you are not alone, and there are resources and strategies available to help you navigate this journey. If you found this information helpful, please consider subscribing to our channel for more insights on mental health, wellness, and personal development. Together, we can raise awareness and support each other in living our best lives, regardless of the challenges we face.